The development of handheld dental X-ray tubes further increases the portability of post-mortem dental imaging. With this rechargeable battery-operated equipment fitting inside standard-sized hand luggage, the dental imaging service can be delivered in remote areas around the world. Digital imaging software can allow images to be sent over secure networks for review by appropriate personnel.
Right, so this is the FDI technique, classification of teeth,
Yep.
which is slightly different from what you're used to. Okay, so each tooth is
Yep.
anatomically numbered,
Okay.
individually. So we're going to start off by doing the upper left central incisor, which is this
Okay,
tooth
so that'll
here.
be 21.
21,
Yep.
excellent. Okay, come over onto the right side here, and we're going to do the bite wing area. Okay,
Okay.
it's the premolar and the molar. Okay,
Yep.
so over on the right side, we're going to do between 14 and 17. So do a big circle. We're going
Yeah.
to include 44
Okay.
and 47.
Yep.
Excellent. Over on the left side, okay, we're going to do the same thing again. Again, premolars 24, 25, 26, 27, 34,
Okay.
35, 36, 37. Okay. And that's just to demonstrate the crowns. And we've also been asked back here to do a wisdom tooth right at the back here. So on the left-hand side,
Left lower right, so
that's
it's
number
38.
38.
Yep.
Yep.
Okay,
All right. Excellent.
good.
Probably the first challenge that you're going to have is to actually get into the mouth to start with. And we're fortunate in this situation because the dentist will have already examined the patient or the case anyway. So they'll have got in, so they'll know how to get access for you. So they're always there to help you out. If you do have any problems though, just try and massage the temporomandibular joints, which are just here, just in front of the ears.
Yep.
Massage them. This is usually beneficial when the body's cold, just come out of the refrigerator or anything like that. And again, what you can do is just gently rock the bottom. So sometimes it clicks, there's no real damage, but just gently but firmly just rock, open and close, and you can generally open the mouth quite wide using that. But generally speaking, you don't need the mouth open that wide to do these films. So we're going to start off with, we were asked to do the 21 first of all, which is the upper left incisor, central incisor, which is that tooth there.
Yep.
Yep. Okay, so what we need is a sensor, and this is a small sensor, generally called, we sometimes call this the pedo film sensor.
Yep.
Okay, sometimes use a pediatric film, but it's generally the smaller of the two sensor sizes. Okay, so we need a film holder such as this, and this is labelled as an anterior film holder. Okay, it's got a long 90-degree curve on it, and that just clicks into the back very simply. Okay,
Yep.
this one just gets run onto the side. Okay, and then I just want you to put the centering arm on the side there for me. All right, and what you're trying to do, the objective is just put the receptor in the middle of that ring. So just give it one check just to see if it's in the middle.
That looks okay to me.
Okay, excellent. We're going to put this protective sheath on in here, and for infection control mainly. And so just goes on over the end, and it just protects all the equipment and prevents cross-contamination. Okay, so we just put that on the end. All right. So again, we're doing this tooth here. Again, we're opening. We just slide the image in horizontally first of all, and then just over the anterior teeth. And we're ensuring that the image receptor at the back is parallel to the plane of the teeth here. So that's, make sure it's fairly far back from the teeth, but it's parallel all the same. Okay? And what we'll find usually is once we've opened the mouth, it's quite difficult to close it again. So we'll probably need lots of padding and instruments to stabilise it. Something that's very beneficial is this piece of, it's just a rigid piece of plastic. You could use a ruler, for example, anything like that, and you just wedge it between the posterior teeth, and there you go, that's fairly stable. It doesn't move. You can use, as you've got here, you can use cotton wool rolls. In this scenario though, you tend to use quite a lot of those. So you're probably better off with something like this, and they tend to get a little bit slimy. Okay, so that's your positioning done. Once you've got that, once it's all set up, it's fairly straightforward. So you've just got your imaging tube there.
Yep.
So what I want you to do is just, you see these lines here on the side? Just line that up with that metal line, just so it's pointing downwards, and so it matches the blue ring. just position that, and also that the ring of the X-ray tube lines up with the blue ring.
Okay.
Fantastic. That's great.
Lovely. So we need
Okay.
to just...
Have a fiddle there, just
Yeah.
to make sure it's nice and straight.
Good.
Okay. Okay. All right. If you just
Okay.
go back behind the screen
Yeah.
now. All right. Okay. And then put anterior. X-rays. And that's it. So we're doing a bite wing, the left bite wing. Experience tells me this always slides around. It's quite difficult to position these bite wing holders. So what we use is this plastic tape here. It's called Transport. Absolutely fantastic stuff, and you'll use loads and loads of it in dental radiography, particularly in this particular situation. So what we do is we just tape it round.
Yeah.
Don't use the paper-based ones, the micropore. They're really not useful at all in this situation. They get very mushy and messy very quickly. It's the plastic tape that you need. Okay, so that just tapes round,
Yeah.
and that keeps that nice and secure. All right?
Okay. Okay.
Okay. That's fine. Excellent. That's cool.
Okay.
Okay, and then we just push closed. That's brilliant. Okay, as far as we can get. And again, we're going to have to keep this mouth closed somehow. So if we just push that, keep that chin pushed up.
Okay.
There's several ways we can do this. And basically we just have to improvise, okay? Obviously you can't be there holding the gin all the way through the exposure, so you can either use sometimes a box of gloves on the chest here, and that resting on the chest there, it keeps the mouth closed. Again, if you tip the head forward as well, rest it on a boulder or a
Right.
pillow,
Yeah.
and then that will keep the chin closed as well. Take it out. Okay, that just slides out. Okay, and then just slots right on the front of the image there. Okay, and that gives you a little bite tab. Okay, but it can also fold down flat, so
Yeah.
you can get that right in the mouth. You'll find that a lot easier if you do have problems opening the mouth.
Okay, yeah,
Okay, so you
just
can
fold it
fold it
like
down
that.
flat. Yep.
Like that.
Excellent. Close now.
Okay.
Okay. Okay, and then we close down,
Yeah.
like that. And the useful thing about this is you've always got a reference there. That paper tab gives you a reference, so you know where the centre of the film is. All right, so that's very useful. Here we go. You centre the tube in exactly the same way.
So
Okay.
that way.
Again, 10
Down a
degrees
little bit.
posterior. Yep, and
And that.
10 degrees caudally. This one we're doing the wisdom tooth at the back on this side, the number 38. Okay, and using the film holder here, we just come in slightly horizontally at the bottom, and you'll find there'll be some resistance from the tongue on this side, so it always needs to be pushed aside. Okay, so you just reflect the tongue back. That's it. Okay.
Okay, yeah.
And you'll get to this point and you won't be able to get any further back because you'll meet resistance. And what you need to do is reflect
Ah, yes.
the cheek
Yeah.
back, okay? Otherwise you won't get any further
Yeah.
back. All right? And so a little wiggle. And again, it's just gentle pressure, wiggling backwards and forwards until you get further back in the mouth. And you might need some assistance. Just putting this in between, sandwiching it in between, and just rocking backwards and forwards until you get further and further back into the back of the jaw. There we go. And again, it's a fair old challenge getting the mouth to close again. And again, you can use
Yep.
this rigid plastic to hold that in place. Centering ring closer to the skin, so it's touching the skin surface. And there you're all set up. Okay, you just match that to the centering ring again. And make sure this line is parallel to that line.